So what is more risky, avoiding the surgery or undergoing the surgery?
See, avoiding the surgery again depends on what condition we are treating. So if it is a condition which is static and not growing, I think that patient can take some time. For example, if there is a condition called trigeminal neuralgia, in which there is a blood vessel sitting on the nerve, and I explained to the patient that your risk of surgery is just about 1%. But since this pathology, this disease is not something which will grow, it is causing pain. Of course, the patient will have to bear the pain for a longer time if they want to think for a longer time. But at least the disease is not growing. Now imagine a large tumor which is sitting right next to the motor area of the brain, and the patient has already started having weakness, let's say on the left hand. Then I usually do not advise waiting beyond a week or two, because if such a patient decides to wait longer and think more, they are going to have more and more weakness.
Timely treatment is very
important. So in most cases, I would say it merits that the treatment be carried out promptly, and the risk of treatment is far less than the risk of carrying the disease.
So here I would like to take a question that what are those most common conditions, brain conditions, where you advise the surgery, and which are those conditions where you don't advise the surgery?
So I think actually that's going to be a very, very long list, but I'll tell you the common things that we treat, and for them we advise patients to get surgery done very promptly, not wait. These are tumors in the brain and surrounding areas like the pituitary gland or one of the nerves of the brain. So in this condition, what we advise is that surgery should be done promptly. And the good thing is that we have a non-invasive method also for managing some of these patients with the CyberKnife. So for a smaller tumor, surgery may not be required. We can use a non-invasive method called CyberKnife Neurosurgery.
Yes, sir.
But for the most part, large tumors need to be removed. Blood clots, fluid collections of infection like empyema or abscess, they need to be cleared out very promptly. Excess fluid in the brain like hydrocephalus, that will need a small shunt operation very promptly. A condition in which we generally do not advise surgery. These conditions are infections and inflammations in which these can be managed medically. So there is inflammation of the nerves or a condition like multiple sclerosis. So these kind of conditions do not need surgery. Stroke, which is due to a part of the brain either not receiving the blood supply or due to bleeding inside the brain. So the part where there is a large blood clot inside the brain, that needs emergency, at times emergency and very, very prompt surgery. Because if the pressure inside increases suddenly, then it causes a danger to the life. So in those situations, actually we have to act very, very fast.
Okay.
So these are the conditions in which neurosurgery is usually advised. And these are structural conditions in which we have to act on the structure of the brain to relieve it.
Right.
But other conditions now are also becoming indications for neurosurgery. So I'll give you a couple of examples. Number one, epilepsy, which is not responding to medicines. So there is epilepsy despite 3 medicines not responding to the medicines at all. Then there is a very high chance we can do a special kind of surgery to relieve that epilepsy. Another example, Parkinson disease, very common. 1% of the population is having Parkinson disease. So Parkinson disease in the advanced stage, when the patient is needing medicines practically every 2 to 3 hours. That is another area in which we can do deep brain stimulation for Parkinson disease and give the patient a much better quality of life. And finally, as I said, that patients sometimes get detected with small tumors which are not causing any problem to them. And we can treat those non-invasively using the CyberKnife with a 0% risk and 0% pain.
So what are the safety protocols you follow before the surgery, during the surgery and post-surgery?
Yeah, so see, there are a number of protocols. So there is a patient safety protocol in which we analyze if the patient has a risk of fall. Is the patient, because of the age, is it a vulnerable patient or not? And we do a full pre-op anesthesia related assessment as to what diseases the patient is suffering from. Then their entire lab parameters are analyzed. and we ensure that safety is paramount and this procedure is going to be safe for the patient. Before the operation also, there is a infection control protocol in place. So for example, patient who's going to have a brain surgery, we ask them to have a chlorhexidine solution scalp wash 2 times before the operation. Now, when they are taken up for the operation, there is a whole WHO safety checklist in which it is ensured that we are taking up the correct patient, correct side, correct disease that we are treating, what is the correct plan, the correct team or the correct person is treating that patient in the operating room. So there is a number of checklists which are there on the surgical side and on the anesthesia side.
Right. So I'm sure patients will get a lot of relief who are supposed to undergo the neurosurgery. They will get a lot of relief by hearing this, that there are so many protocols are taken care of.
There are a number of protocols which are, and for each disease actually we have a specific protocol. So for patient with a pituitary tumor, this patient does not get the same medicine like a patient with another kind of brain tumor.
Right.
And sometimes if we are treating a patient in an emergency, sometimes we have to overlook some protocols because we have to rush this patient to save their life. So all these protocols are there only for patients who are having elective surgery. Once a while we have to forget everything, and patient is in such a situation, we just have to take the patient into the operating room.
So we can say patients are in safe hands.
Patients are in safe hands, and as I said, the bottom line is good team with a good skill level and experience, good technology, and good teamwork. I think this is very, very important.
And what post-surgery symptoms are considered as normal, and which post-surgery symptoms are considered as, they may create worry?
See, if the patient post-operatively, let's say, is not waking up completely, the consciousness level is down, or if the patient has a new problem like a weakness or unable to speak or a decline in vision, you see, then we have a protocol in place. We immediately get a CT or MRI done for these patients, and we have to arrive at the reason for this. So most of the times it could be just some slight swelling, and you give treatment for that, and these things will recover. As a protocol, the next morning after the surgery, we will always do a CT scan to look at the space inside the brain where we've done the surgery. What does it look like? Does it have a blood clot? Does it have a swelling?
Okay.
So that is something which we do preemptively.
Right.
The older thought process is that you do a CT only if patient is having a problem. But we routinely do a CT because we want to preempt any swelling or any other issue cropping up. And post-operatively, the common things which are not worrisome is a little bit of pain around the operative side.
Okay.
So if I've done a pituitary surgery through the nose, then obviously the nose is being blocked by the dressing which is there. So the patient will have to do mouth breathing for a couple of days. So these kind of inconveniences and discomfort to a small degree will be there. Some kind of pain, heaviness, feeling of weakness and fatigue. Probably that is also because of the anxiety, So these are the common things which we find after the surgery. Slight degree of swelling around the operative area, a bit of nausea or vomiting. So these are very, very common after surgery, but they are very mild, and usually they are there for maximum few hours to 1 day.
So, sir, in era of modern neurosurgery, and then we have leading neurosurgeons like you, can we say India is comparable to Western countries in terms of neurosurgery related safety and technology?
I think very much so. And I think the data is in front of you. See, we have patients coming to us from many, many parts of the world. And you know that in many parts of the world, even to reach a specialist, it takes a couple of weeks. So, for example, if you're in the US and if you want to meet a neurosurgeon, you have to first go to your primary physician. That person will refer you to a neurosurgeon. And don't be surprised, it could take you 3 weeks or 4 weeks to just get an appointment with a neurosurgeon.
That's true, sir.
So here we have excellent access. And I think in the big cities of the country, you have modern neurosurgical centers with all the cutting edge facilities which a patient could need. And in the past 10 years, I have seen that there is a lot of improvement in the protocols, technology, teamwork. And that is why you have people coming in large numbers from many areas of the world that are underserved. And the good thing is we are able to do a very good job with these patients who come to us for receiving our care, and we are able to do it very efficiently in less time and less money than most of the developed countries are able to do.
So how long for an international patient is the stay if he's coming all over the way from his country and he's having the neurosurgery in India? So how long he is supposed to stay in India?
So I'll give you some typical timelines. So for example, if I see a patient in my clinic today, I'll ask for some investigations like a good quality MRI if I'm not able to correctly see the thing which I'm supposed to treat. Maybe I can line that patient up for a procedure within 3-4 days or 5 days. And after the surgery, the patient will be in the hospital for just about 4 days. So we admit an evening prior. On the day of the surgery, the patient is in the ICU. We keep the patient for another 2 days in the room. And on post-op day 3 in the morning, the patient will get discharged. So from the time of coming, and typically we remove the sutures around the 8th or 9th day. By 4th or 5th day after the surgery, we get the biopsy report. So if the patient does not need any further treatment, I would say very easily the patient can fly back home within 2 weeks of landing in the country.
After neurosurgery?
After neurosurgery.
Wow.
So that is something phenomenal.
Great.
Of course, patients who need radiation and chemo, they have a bad tumor which needs further treatment, then they can take a call whether that treatment should be done back in their home country, because that is a more extended treatment. It will take about a month or so for the radiotherapy to finish. So that's a call they can take. Now for CyberKnife, it's even more amazing.
Yes.
So if I have a patient with a small tumor that does not need surgery, so if I see a patient today in my clinic, maybe I will admit that patient tomorrow for a one-night admission for a detailed imaging and planning. Day after tomorrow, the patient will get discharged. I will need 2 days to make a very, very nice, precise plan for that patient. After 2 days, the patient comes from wherever they're staying in the hotel, 40 minutes on the CyberKnife machine, and on the same day, they can catch a flight back. So
Wow,
this patient with a small brain tumor can return to their country in 5 days.
Wow. So what would you say to those patients who are abroad and who are looking for neurosurgery? And what would you say to them if they are so much afraid?
So I think first thing they have to understand, and which is a reality, that look at the kind of technology progress which has happened in neurosurgery. And if you go to a center which has a skilled, experienced team, which has excellent modern technology, and they have a good level of teamwork between the different teams that will be treating the patient, I think ballpark, I would say the risk of surgery is very close to 1%. And that is the figure they should carry in their mind. Not feel that, oh, this, my whole head is going to get opened and after surgery, this is going to happen, that is going to happen. And as I said, very importantly, what we see time and again is that those 1% patients who are not doing well either because of a bad disease or they had these problems even before the operation, those 1% patients are actually speaking about their experience to thousands of people, and thousands of people are actually thinking that this is the case with every surgery that is happening. So this is actually a thing to be understood, and they should not accept this at face value that this is what is going to happen to us.
So now we come to our myth busting session. So we have to bust 2 myths related to brain surgery, anxiety or worry. What would that be?
So I think the first myth is what we've largely discussed in the last 15 minutes, is that the first myth is that brain surgery is dangerous. I would say you need to change the word. You have to say brain surgery is life-saving, life-enhancing.
Wow.
And the reason why I say that is true. If you ask and if you see patients in the hospital, if you see patients on my floor, they've had brain surgery and they're walking on the floor and they're talking to their family members, they're eating a meal, you will understand that this whole thing about brain surgery being dangerous has been overblown, has been overstated. And the second myth I would like to bust is that brain tumor means cancer. So brain tumor does not mean cancer. A tumor is just a solid lump which can be either cancerous or non-cancerous. And the good thing is the majority of the patients that we see and treat are non-cancerous tumors. So one very, very important reason of the fear is that patients confuse the term tumor with cancer. And once they confuse it, obviously the anxiety level is going to be very high. So the second myth to be busted is brain tumor does not mean brain cancer. Majority of brain tumors are non-cancerous. They are very easily treatable. And after treatment, the patient can continue to enjoy a normal quality of life and a normal longevity.
Thank you so much, sir. It has been such an insightful session. You have answered almost of all our doubts and questions. Thank you so much.
No, it was a pleasure. I was very happy to meet all of you.
Thank you. So whenever there's a surgery, anxiety is natural, but modern neurosurgery is more precise, advanced, and safer than ever before. Ask question and seek clarity. So if you have medical reports or MRI scan, and you want to get these reviewed by Dr. Aditya Gupta, please do send those reports to us and we will get back to you with the expert opinion. Ask DoctoGenie session will keep bringing such medical procedure-based topics for you. Stay tuned. Thanks for joining in and we'll see you in the next episode.